Question 1. Which of the following is the drug of choice for immediate relief of acute angina attack? A. Atenolol. B. Sublingual nitroglycerin. C. Isosorbide mononitrate. D. Verapamil. Answer: B. Sublingual nitroglycerin. Rationale: acts within 1 to 3 minutes by bypassing first-pass metabolism, produces venodilation, lowers preload, and reduces myocardial oxygen demand. Strategy: nitro under the tongue equals instant relief. Short-acting nitrates are for acute, while long-acting are for prophylaxis. Question 2. Which class of drugs reduces myocardial oxygen demand by lowering heart rate and contractility? A. Nitrates. B. Calcium channel blockers. C. Beta blockers. D. Nicorandil. Answer: C. Beta blockers. Rationale: block beta receptors in the heart, reducing HR and contractility, thus decreasing oxygen consumption. Strategy: beta equals block the heart's speed and squeeze. They're best for exertional angina but contraindicated in Prinzmetal's angina. Question 3. Which of the following is a long-acting nitrate? A. Nitroglycerin. B. Isosorbide mononitrate. C. Nicorandil. D. Adenosine. Answer: B. Isosorbide mononitrate. Rationale: has high oral bioavailability, longer duration, and is useful in prophylaxis of angina attacks. Strategy: mono equals maintenance. If you see mononitrate, think long-term prevention. Question 4. Which of the following is not used in angina management? A. Ranolazine. B. Ivabradine. C. Digoxin. D. Isosorbide dinitrate. Answer: C. Digoxin. Rationale: digoxin is used in heart failure and atrial fibrillation, not in angina management. Strategy: always check for the odd drug out. If it doesn't affect oxygen supply or demand, it's not anti-anginal. Question 5. What is the primary mechanism of nitrates in relieving angina? A. Arteriolar vasodilation after load. B. Venodilation preload. C. Direct cardiac stimulation contractility. D. Sodium channel blockade. Answer: B. Venodilation preload. Rationale: nitrates release NO-activate guanylyl cyclase cGMP venodilation venous return and O2 demand. Strategy: nitrates act mainly on veins. V for veins, V for venodilation. Question 6. Which drug selectively inhibits the funny current, if, in the SA node? A. Verapamil. B. Ivabradine. C. Ranolazine. D. Nicorandil. Answer: B. Ivabradine. Rationale: slows HR without affecting contractility by blocking if current in the SA node. Strategy: funny heart equals Ivabradine. Think of Ivabradine as a heart rate reducer without BP drop. Question 7. Which of the following is a cardioselective beta blocker commonly used in angina? A. Propranolol. B. Bisoprolol. C. Nadolol. D. Timolol. Answer: B. Bisoprolol. Rationale: bisoprolol, beta-selective, reduces HR and contractility with less bronchospasm risk compared to non-selective beta blockers. Strategy: selective beta blockers, atenolol, metoprolol, bisoprolol. Remember with AIIMS, first half of alphabet equals selective. Question 8. Which drug class is contraindicated in Prinzmetal's variant angina? A. Nitrates. B. Calcium channel blockers. C. Beta blockers. D. Nicorandil. Answer: C. Beta blockers. Rationale: they block beta-2-mediated vasodilation, leading to unopposed alpha-mediated vasospasm. Strategy: Prinzmetal hates beta blockers. Always choose nitrates or CCBs here. Question 9. Nimodipine is especially indicated for A. Stable angina, B. Variant angina, C. Cerebral vasospasm after subarachnoid hemorrhage, D. Hypertensive crisis. Answer, C. Cerebral vasospasm after subarachnoid hemorrhage. Rationale. Nimodipine has high affinity for cerebral vessels, preventing vasospasm after hemorrhage. Strategy. Nimo equals neuro. Link nimodipine with brain-related vasospasm. Question 10. Which of the following is not a calcium channel blocker? A. Amlodipine, B. Diltiazem, C. Verapamil, D. Atenolol. Answer, D. Atenolol. Rationale. Atenolol is a beta blocker. CCBs are either DHPs, Dipines, or non-DHPs, Verapamil, Diltiazem. Strategy. Look for the dipine suffix to quickly identify DHP calcium blockers. Question 11. Which calcium channel blocker may cause reflex tachycardia when used alone? A. Verapamil, B. Diltiazem, C. Nifedipine, D. Amlodipine. Answer, C. Nifedipine. Rationale. Potent vasodilation causes sudden BP drop baroreceptor-mediated tachycardia. Strategy. Nifedipine equals nasty reflex tachycardia. Question 12. Which nitrate undergoes high first-pass metabolism? A. Nitroglycerin, B. Isosorbide dinitrate, C. Isosorbide mononitrate, D. Nicorandil. Answer, B. Isosorbide dinitrate. Rationale. Significant hepatic metabolism makes oral bioavailability low. Strategy. Think dinitrate equals destroyed by liver. Question 13. What is the major drawback of continuous nitrate therapy? A. Bronchospasm, B. Tolerance, C. Bradycardia, D. Constipation. Answer, B. Tolerance. Rationale. Occurs due to depletion of sulfhydryl groups, efficacy decreases with continuous use. Strategy. Nitrates need a break. Give nitrate-free intervals, 10 to 12 hours. Question 14. Which drug shifts metabolism from fatty acids to glucose to improve oxygen efficiency? A. Ranolazine, B. Ivabradine, C. Trimetazidine, D. Nicorandil. Answer, C. Trimetazidine. Rationale. Glucose oxidation requires less O2 than fatty acid oxidation, improving efficiency. Strategy. Trick metabolism equals trimetazidine. Question 15. Which drug may cause visual brightness, phosphines? A. Ranolazine, B. Ivabradine, C. Amlodipine, D. Verapamil. Answer, B. Ivabradine. Rationale. Inhibits retinal IH channels transient luminous phenomena. Strategy. IVA equals IC lights. Question 16. Which drug is both a potassium channel opener and has nitrate-like action? A. Nicorandil, B. Ranolazine, C. Ivabradine, D. Diltiazem. Answer, A. Nicorandil. Rationale. Dual action, opens ADP-sensitive K channels plus releases NO. Strategy. Nico equals nice combo, K opener plus NO donor. Question 17. Which class of drugs is best for effort-induced, stable, angina? A. Beta blockers, B. Nitrates, C. Calcium channel blockers, D. Antiplatelets. Answer, A. Beta blockers. Rationale. Reduce HR and contractility during exercise, preventing ischemia. Strategy. Stable effort equals slow the heart with beta blockers. Question 18. Which of the following drugs is used for prophylaxis, not for acute angina relief? A. Sublingual nitroglycerin, B. Isosorbide mononitrate. C. 4-nitroglycerin. D. Nicorandil, sublingual. Answer: B. Isosorbide mononitrate. Rationale: long-acting, prevents attacks, not effective acutely. Strategy: mononitrate equals maintenance. Question 19. Which is the mainstay of therapy in unstable angina? A. Antiplatelet agents. B. Sublingual nitrates. C. Calcium channel blockers. D. Ivabradine. Answer: A. Antiplatelet agents. Rationale: aspirin and clopidogrel prevent thrombus progression in unstable angina. Strategy: unstable equals think clot, so give antiplatelet. Question 20. Which beta blocker has vasodilatory properties due to nitric oxide release? A. Atenolol. B. Bisoprolol. C. Nebivolol. D. Metoprolol. Answer: C. Nebivolol. Rationale: in addition to beta blockade, it stimulates NO release causing vasodilation. Strategy: nebivolol equals NO booster. Question 21. Which calcium channel blocker is contraindicated in heart failure? A. Amlodipine. B. Verapamil. C. Felodipine. D. Nicardipine. Answer: B. Verapamil. Rationale: verapamil is a negative inotrope and can worsen heart failure by depressing contractility. Strategy: very bad in heart failure equals verapamil. Question 22. Which of the following is a side effect of nitrates? A. Constipation. B. Headache. C. Hyperglycemia. D. Dry cough. Answer: B. Headache. Rationale: vasodilation of cerebral vessels causes throbbing headache. Strategy: nitro headache equals common, not dangerous. Question 23. Which drug inhibits late sodium current in cardiac cells? A. Ranolazine. B. Ivabradine. C. Trimetazidine. D. Nicorandil. Answer: A. Ranolazine. Rationale: reduces intracellular calcium overload, improving diastolic relaxation and oxygen use. Strategy: ranolazine equals reduce NA entry. Question 24. Which calcium channel blocker has the greatest effect on heart rate? A. Verapamil. B. Diltiazem. C. Amlodipine. D. Felodipine. Answer: A. Verapamil. Rationale: strongest depression of AV node conduction slows heart rate. Strategy: very strong on the heart equals verapamil. Question 25. Which beta blocker is non-selective? A. Atenolol. B. Metoprolol. C. Propranolol. D. Bisoprolol. Answer: C. Propranolol. Rationale: blocks both beta and beta-2 receptors, higher risk of bronchospasm. Strategy: pro equals problem for lungs. Question 26. Which drug is preferred in variant, Prinzmetal, angina? A. Propranolol. B. Diltiazem. C. Atenolol. D. Bisoprolol. Answer: B. Diltiazem. Rationale: CCBs relax coronary vasospasm, beta blockers worsen it. Strategy: Prinzmetal loves calcium blockers, hates beta blockers. Question 27. Which nitrate preparation is suitable for acute for use in unstable angina? A. Oral isosorbide mononitrate. B. 4-nitroglycerin. C. Sublingual isosorbide dinitrate. D. Oral nicorandil. Answer: B. 4-nitroglycerin. Rationale: allows rapid titration and control in acute coronary syndromes. Strategy: for nitro equals ICU emergency. Question 28. Which side effect is common with calcium channel blockers of the dihydropyridine group? A. Constipation. B. Ankle edema. C. Bradycardia. D. Cough. Answer, B. Ankle edema. Rationale. Peripheral vasodilation, fluid extravasation into dependent tissues. Strategy. Dipping S equals dependent edema. Question 29. Which beta blocker is safest in asthma patients? A. Propranolol. B. Atenolol. C. Nadolol. D. Timolol. Answer, B. Atenolol. Rationale. Beta-selective, less likely to cause bronchospasm than non-selective ones. Strategy. Asthma? Always choose a selective one, A.M. Question 30. Which drug may cause constipation as a side effect? A. Amlodipine. B. Verapamil. C. Nitroglycerin. D. Ranolazine. Answer, B. Verapamil. Rationale. Inhibits intestinal smooth muscle contraction, leading to constipation. Strategy. Very constipating equals verapamil. Question 31. Which of the following is not an anti-anginal drug? A. Nitroglycerin. B. Ranolazine. C. Ivabradine. D. Digoxin. Answer, D. Digoxin. Rationale. Digoxin is used in heart failure/AF, not angina. Strategy. Always eliminate drugs unrelated to coronary circulation or O2 demand. Question 32. Which drug increases exercise tolerance without affecting HR or BP significantly? A. Ranolazine. B. Ivabradine. C. Nicorandil. D. Atenolol. Answer, A. Ranolazine. Rationale. Improves diastolic function and reduces ischemia without major hemodynamic changes. Strategy. Ranolazine equals resistance to exertion. Question 33. Which beta blocker has membrane stabilizing activity, quinidine-like? A. Propranolol. B. Atenolol. C. Metoprolol. D. Bisoprolol. Answer, A. Propranolol. Rationale. Can reduce arrhythmias but also causes CNS side effects. Strategy. Propranolol equals proarrhythmia control. Question 34. Which nitrate should be avoided with sildenafil, Viagra? A. Nitroglycerin. B. Isosorbide mononitrate. C. Isosorbide dinitrate. D. All of the above. Answer, D. All of the above. Rationale. Combination severe hypotension due to excess cGMP accumulation. Strategy. Nitrates plus Viagra equals no-go. Question 35. Which calcium channel blocker is safest in heart failure patients? A. Amlodipine. B. Verapamil. C. Diltiazem. D. Nifedipine. Answer, A. Amlodipine. Rationale. Minimal negative inotropic effect compared to others. Strategy. Amlodipine equals acceptable in HF. Question 36. Which beta blocker is used for angina and migraine prophylaxis? A. Propranolol. B. Atenolol. C. Metoprolol. D. Bisoprolol. Answer, A. Propranolol. Rationale. Non-selective, effective in both angina and migraine prevention. Strategy. Pro equals protects from pain in head and heart. Question 37. Which drug decreases heart rate without affecting contractility or BP? A. Ivabradine. B. Metoprolol. C. Amlodipine. D. Verapamil. Answer, A. Ivabradine. Rationale. Blocks if current in SA node only. Strategy. Funny current blocker equals funny heart rate reducer. Question 38. Which anti-anginal drug is contraindicated in pregnancy? A. Nicorandil. B. Atenolol. C. Nitroglycerin. D. Amlodipine. Answer: B. Atenolol. Rationale: associated with intrauterine growth restriction. Strategy: avoid atenolol in pregnancy. Question 39. Which drug relieves angina by decreasing myocardial oxygen consumption and increasing coronary blood flow? A. Nitrates. B. Beta blockers. C. Calcium channel blockers. D. All of the above. Answer: D. All of the above. Rationale: each class acts differently but contributes to reduced ischemia. Strategy: if more than one drug fits, choose all of the above. Question 40. Which nitrate is given as a transdermal patch for prophylaxis? A. Isosorbide dinitrate. B. Nitroglycerin. C. Nicorandil. D. Ranolazine. Answer: B. Nitroglycerin. Rationale: transdermal nitroglycerin provides sustained release for prevention. Strategy: patch equals prevention. Question 41. Which beta blocker is least likely to cross the blood-brain barrier? A. Propranolol. B. Atenolol. C. Metoprolol. D. Bisoprolol. Answer: B. Atenolol. Rationale: hydrophilic, poor CNS penetration, fewer CNS side effects. Strategy: atenolol equals avoids brain. Question 42. Which calcium channel blocker can cause gingival hyperplasia? A. Verapamil. B. Amlodipine. C. Nifedipine. D. Felodipine. Answer: C. Nifedipine. Rationale: overgrowth of gums due to abnormal fibroblast activity. Strategy: nifedipine equals nasty gums. Question 43. Which drug improves oxygen supply by dilating coronary arteries? A. Beta blockers. B. Nitrates. C. Calcium channel blockers. D. Both B and C. Answer: D. Both B and C. Rationale: both nitrates and CCBs cause coronary vasodilation, improving supply. Strategy: always think of nitrates plus CCBs equals supply side. Question 44. Which nitrate is preferred in cyanide poisoning? A. Amyl nitrite. B. Nitroglycerin. C. Isosorbide dinitrate. D. Isosorbide mononitrate. Answer: A. Amyl nitrite. Rationale: induces methemoglobinemia, binding cyanide. Strategy: amyl equals antidote. Question 45. Which beta blocker has both alpha and beta blocking properties? A. Propranolol. B. Labetalol. C. Atenolol. D. Metoprolol. Answer: B. Labetalol. Rationale: blocks alpha, beta, and beta-2 lowers BP and HR. Strategy: labetalol equals lab for both alpha and beta. Question 46. Which drug is used in refractory chronic angina when other drugs fail? A. Ranolazine. B. Nitroglycerin. C. Diltiazem. D. Atenolol. Answer: A. Ranolazine. Rationale: last-line agent for chronic angina, improves exercise tolerance. Strategy: R equals reserve equals ranolazine. Question 47. Which nitrate has the fastest onset of action? A. Sublingual nitroglycerin. B. 4-nitroglycerin. C. Oral isosorbide mononitrate. D. Transdermal patch nitroglycerin. Answer: A. Sublingual nitroglycerin. Rationale: acts in 1 to 3 minutes, bypassing liver metabolism. Strategy: under the tongue equals under 3 minutes. Question 48. Which drug is avoided in combination with verapamil due to risk of AV block? A. Digoxin. B. Propranolol. C. Ranolazine. D. Nitroglycerin. Answer, B. Propranolol. Rationale. Both depress AV node, increasing risk of heart block. Strategy. Never combine non-DHP CCBs with beta blockers. Question 49. Which of the following anti-anginal drugs does not reduce heart rate? A. Atenolol. B. Verapamil. C. Ivabradine. D. Nitroglycerin. Answer, D. Nitroglycerin. Rationale. Nitrates reduce preload but don't directly slow HR, may even cause reflex tachycardia. Strategy. Nitro equals no HR effect. Question 50. Which is the first-line therapy for chronic stable angina? A. Nitrates. B. Beta blockers. C. Calcium channel blockers. D. Ranolazine. Answer, B. Beta blockers. Rationale. Reduce HR, BP, and contractility, improving exercise tolerance and survival. Strategy. Stable equals slow the heart, beta blockers. Well done, future RN. You've just practiced some of the most difficult pediatric NCLEX questions designed to challenge your critical thinking. Now, let me ask you. How many questions did you get correct out of 50? Drop your score in the comments, I want to see how well you did. Remember, every time you practice, you're one step closer to beating the NCLEX. Keep learning, keep practicing, and never fall into the top 10 mistakes that fail students. If you found this helpful, don't forget to like, subscribe, and share this with another nursing student who needs it. See you in the next video, and remember, success on NCLEX is about practice, not perfection.